between your internal, external environment. Everything you think, feel, and do impacts your skin health. So we have to incorporate that into somebody's skincare regimen.
Welcome to That's Derm Good. I'm Janelle Ball, and I'm excited to bring you thought-provoking conversations about biologics, specialty medications, treatments, and so much more. I'll be chatting with some amazing guests about access, affordability, and advocacy. You're really going to enjoy this show. Welcome to That's Derm Good. Today, my guest is Dr. Keira Barr. Dr. Barr is a dual board certified dermatologist, founder of the Center for Mind Skin Medicine. Welcome, Dr. Barr. Thank you for joining me.
Thank you for having me. I'm super excited to have this conversation.
Yes. So you're founder of Center for Mind Skin Medicine. Can you tell me a little bit about that?
Yes. We talk about like the mind-body connection, and it's similar, the mind-skin connection. Most people may or may not know that the skin, the brain, the nervous system, they're all derived from the same layer of embryologic tissue. So they are in constant communication all the time. So it's a matter of, can we understand the language that they're speaking? And if they're speaking a language of things showing up on our skin that may not be what we want to see, or indications of something happening beneath the surface, we can, offer the support to maybe change the dialogue.
Yeah. So is it, when patients come in, do they think they're just coming in to schedule an appointment with the doctor for dermatology skin check or?
Yeah, I no longer have a conventional clinical dermatology practice. So I rely on my colleagues to write the prescriptions, make the diagnoses. I'm really at the intersection of skin health and mental health, what the subspecialty of dermatology called psychodermatology. Mm-hmm. And so when people come to me, like one of my most recent clients, he's already seen 8 dermatologists. He knows he has rosacea. He's failed every single treatment. He's been in talk therapy for years. And so when people come to me, it's kind of like they've done the diets, the cleanses, the parasite, you're right, like parasites, all the products, all the things, and they're still not getting better. And they know there's something more. So that's kind of where we begin. We start of what's happening on the surface, but immediately go beneath it and really explore all the ways that oftentimes chronic and traumatic stress is either triggering, exacerbating the condition, or is resulting from living with a visible skin condition. So I'm really there more in a therapeutic modality than a clinical, strategic, tactical treatment approach that we would see in conventional dermatology.
Yeah. What led you to more of this approach versus traditional dermatology?
Yeah, I had been in conventional dermatology for, dating myself, but it's been 20 plus years. I know that because my daughter's 21 now. So I was pregnant with her during residency. I'm like, how many years? I think it's one of those when your mess becomes your mission. So throughout my career in dermatology, I've always been drawn to that mental emotional piece, right? That the shame, the anxiety, the overwhelm that so many of my patients experience living with conditions like psoriasis and alopecia and all of that. But it was my own lived experience that really led me here as well. When I was a kid, can't see them now, but I was born with 2 birthmarks on my face. Kids bullied me for them, called me names. So I spent a lot of my young years and young adult life trying to hide those through tanning, sunburns, all the things, really trying to hide in plain sight, because I thought, well, if they didn't think what was on my skin was pleasing, then maybe they don't think I'm pleasing, right? And I have to shape shift and people please and perform. And it really impacted how I navigated through the world. Well, fast forward, I become a dermatologist, a skin cancer and melanoma specialist, because I'd done a melanoma fellowship, and my own skin was changing from all those years of, sunbathing, growing moles, changing moles. And then there was one that was atypical enough. And as a board certified dermatopathologist, being able to look at your own skin underneath the microscope with horror and being like, oh shit, like that's not right. So that was the tip of the iceberg, that my skin had been whispering over time, all the growing, changing lesions, and then started shouting with this really atypical lesion. And then it was gut issues, hormonal issues, and just my health spiraling down the drain. So I started seeking my colleagues' help in conventional medicine. That wasn't really helping much. So I sought out functional medicine, integrative medicine, trying, herbs and supplements, the cleanses, the diets, all the things that my clients now come to me having tried. So I totally get it. And somehow, some way, I landed in mind body medicine. And I started with mindfulness-based stress reduction, right? And at that point, all the dots started to connect. And I was like, oh my gosh, in all the ways that stress, the exposome, all the things in my external environment, all the things in my internal environment, all the unprocessed emotions and everything that had been suppressed is showing up on the skin surface. And I thought, I'm a physician. I thought I was pretty well educated and I didn't know any of this. How is the average person supposed to make sense? They just are thinking that they're broken. They're told that there's something to be fixed, when in fact, nothing really needs to be fixed. It's about working with the body, understanding that your nervous system, your body is behaving and responding exactly the way it thinks it needs to, because it thinks it's under duress and threat all the time. So that's a very long-winded explanation of, when stuff hits the fan, you got to figure out a different way. And then I wanted to pay it forward.
Right. Yeah. So can you tell me, what is somatic trauma therapy?
Yeah. So soma is Greek for body. Somatic is the living body within. It's really a matter of coming back into our wholeness. So when we typically think about therapeutic modalities, psychotherapeutic modalities, we often think of like a top-down approach. It's the brain, everything's in the mind. We talk it out, right? Somatic therapy brings the body into the equation, because from what we have learned about trauma and stress is that the vagus nerve plays a significant role in that. The vagus nerve is the longest cranial nerve, starts in our brainstem. It has branches that innervate our face, our ear, our throat, our heart, our lungs, organs of our gut. And over 80% of those vagus nerve fibers are what we call afferent or sensory fibers. They are sending information from the body to the brain about how the cues the body's picking up, how the body is functioning. The brain then takes that information and tells all the other organ systems how to respond. So because we know that the body is playing a role, such a significant role via the vagus nerve in how the body functions, we have to bring the body into the equation. So it's what we call a bottom-up approach. So things like breath work, movement, sound, that's somatics, right? We're bringing the body into the equation versus just thinking our way or talking our way out of it, because what we know from the research is that when we are stressed, right? Dr. Dan Siegel, he's a psychiatrist and he has his hand model. And so when we are stressed, he says that, we our thinking brain, our prefrontal cortex, we flip our lid. We can't think clearly rationally. And what's left is the thumb represents the amygdala, the emotional brain. So we're running around almost like a toddler unsupervised, right? With scissors. That's like kind of what's happening, right? So we know that we can't rely on just our mind to help us navigate what's happening, because we also know that in our conscious awareness, we've got lots and lots of thoughts, but only 5% or so of them are really what we're aware of. The rest of the thoughts are underneath the conscious awareness that is really dictating, navigating how we respond, react, behave, and move throughout the world. So we have to find another way to access that and move that energy through.
Yeah. So, it almost kind of sounds a little like yoga or Pilates.
Yeah, it does. And in fact, and I know, and you might think like, oh, this sounds like woo-woo crap. And listen, if you had told me this 10 years ago, that this is what I would be doing, I would have said, you're nuts. This is BS. Show me the data. Show me the science. but there actually is science. And they have done MRI studies. They have done a lot of work looking at different neurotransmitters and looking at the skin and skin conductance. And, the skin itself is a stress response organ. This is why this all makes so much sense, because all the same mechanisms that the brain has to drive that stress response, like the hypothalamic pituitary adrenal axis and release of stress hormones like cortisol, our skin has its own peripheral HPA axis. So our skin is both a target and a source of the stress response. So to your point about Pilates and yoga, I actually recently completed a therapeutic yoga for trauma recovery training, because when you look at the data, they have done, there was even a study, I think maybe it was 2015, looking at yoga and pranayama breathing techniques and the influence it has on cytokine profiles, including, I think it was like IL-15 for wrinkle reduction, right? Because we know that elevated levels of cortisol break down the collagen and they prevent its repair. So movement, ways of breathing, slowing things down, creating cues of safety for the nervous system are actually incredibly therapeutic. And we can see that, on a cellular level, on a physiologic level. So yes, we are using things like Pilates, we are using things like yoga, but to change our physiology and our psychology, it's not just the endorphin of feeling good, it's actually having an impact on a cellular level.
Right. So that trauma and stress can really trigger skin flare-ups.
Yeah, so it's fascinating. So we had written a paper. I don't know if it'll get accepted, because in conventional derm, this is unfamiliar territory, but there is research out there looking at conditions like psoriasis, vitiligo, alopecia areata, eczema, and the role that adverse childhood events plays, right? The ACE study that was done years ago, that the increased number of adverse childhood events, usually this is witnessing horrific abuse or being abused yourself. It really doesn't take into account neglect, which is, the trauma we can't remember, what didn't get to happen, which can have just as significant an impact because of attachment wounds. But the higher the ACE score, the increased risk for chronic illness. And especially in a condition like hidradenitis suppurativa, they showed that the increased number of, the higher the ACE score, it significantly increased the risk of developing HS. Psoriasis, post-traumatic stress disorder, right? The comorbidity between depression and cardiovascular disease and psoriasis. When you look at it on paper, you're like, how do all these things go together, right? But when you think about it from a nervous system, like applied polyvagal lens, so Dr. Stephen Porges is the creator of the polyvagal theory, it basically looks at nervous system as command central. When you look at it from that perspective, and I can go into, I just don't want to babble on too much, but
no, this is great. This is such good information. I'm so fascinated by this.
So, we know that the mind, the brain, the nervous system, and the skin derived from the ectoderm, that same embryologic layer. So it's like a two-way highway, But it becomes a four-lane freeway because the nervous system and the skin are part of what we call the NICE network. The nervous system, the immune system, the cutaneous, and the endocrine system, there are hormones. So it's like this four-way bidirectional communication between them, with nervous system being command central, right? The nervous system gets information, especially from that vagus nerve, that's that wandering from the gut all the way to the lungs and determining how fast the heart should beat, how shallow we should breathe, all the things. And the nervous system then tells all the other organs how to behave, right? So this is why we might see autoimmune conditions. This is why we might see anxiety, depression. This is why we see PCOS, because everything is dysregulated and the whole body thinks in service of our survival, right? This is not that anything has gone wrong. The nervous system acts like our own personal surveillance system. It's constantly scanning our environment, what Dr. Stephen Porges coined neuroception. So it's picking up cues from our external environment, our internal environment, how hungry we are, how thirsty we are, how safe we feel. And it is determining, right, are we safe or is this dangerous? And if the cues of danger outweigh the cues of safety, our survival coping strategies are going to go into effect immediately, like our fight or flight.
Right.
So we start there. We start with the fight or flight. But eventually, if these cues of danger are ongoing, we go down from survivor mode into conservation mode and shutdown. So we need to conserve our energy. This is why chronic fatigue and depression happens, right? You're anxious, and then you only have so many resources. The body needs to conserve, right? So your body is always working for you. It may not be showing you what you want to see on the surface of your skin. It may not offer you the energy or the felt experience that you want to be having, but know that it's doing exactly what it thinks it needs to do based on the cues it's picking up from your environment, externally and internally, which is good news, because that means that we can do an audit of our environment for the most part and see, okay, where can I invite in cues of safety, or at least safe enough on a consistent basis.
Right. I like what you said. It doesn't always necessarily show up on your skin. So when they feel like they're doing everything right and still not seeing or getting those results, what happens with that?
Yeah, it can be really hard, and it can be really frustrating because they've done the diet. Like, I think, in the social media streets and in the more integrative or functional space, everyone focuses on the gut. Fix the gut, fix the gut, fix the gut. And my question is always, yeah, that's important, but that's a downstream outcome of an upstream issue. There's gut dysbiosis, there may be SIBO, because the nervous system is feeling like it's under duress all the time. So we're going to have to swim back upstream. So I think helping people connect the dots of understanding why this has happened, right? When our body feels like it's under duress, what's going to happen? Your body is going to prioritize sending resources to the organs that are required to get you out of danger. Your brain, your heart, your lungs, and your muscles. You do not need to be eating food, and you do not need to be having sex and procreating. This is why fertility issues, I believe, in my personal opinion, because of also environmental toxins and all the things in our environment that are threats to our overall well-being, have increased over time. But the body doesn't prioritize digestion. So digestive enzymes stop flowing in abundance. Gut motility slows down. When gut motility slows down, now there's the potential for an imbalance between the good bacteria and the bad bacteria. The bad bacteria have time maybe to proliferate, and then they release, things like lipopolysaccharides that can poke holes in the gut lining. Holes in the gut lining allow, particles of food and allergens to go out into the system, which triggers inflammation, which can show up on your skin, right? So that gut-brain-skin axis starts to make sense. So yes, you may need to address the gut. You may need to change the diet. Lifestyle factors like sleep and movement are really important. And also, how can we prevent the gut from staying out of balance? Or how can, if we, supplemented, people are starting to feel better, how can we maintain that overall sense of well-being? Well, we have to incorporate things like creating cues of safeness, which can be as simple as checking in. Are you breathing? When we're stressed out, most of us hold our breath, or we breathe very shallow. So just an awareness of breath. Gentle movements. I know that I tend towards that shutdown mode, because in my lived experience, it was safer to be quiet, to not make waves, to be the good girl, right? So I kind of bring myself down. So for me, a little bit of movement, even micro movement, wiggling the fingers, wiggling the toes, a gentle rocking and swaying, which you can be doing. Like, I'm actually doing it a little bit while I'm talking to you, right? It helps keep me grounded. It helps keep me present. So even while I'm a little anxious, I can stay present with what's here for my present experience. So when people are frustrated and upset, when I help explain to them that your body is actually working for you in service of your survival, we just have to start sending it different messages.
Right.
And we just meet you where you are. What is the smallest thing that you feel that you can do? Right? Maybe it is starting a little bit with diet, looking at sleep. Like, we call them resources, right? What are the things, the people, places, things that bring you a felt sense of okayness, a felt sense of joy, happiness? Let's start adding more of those in, because a lot of medical treatments always require you to cut things out. Stop doing this.
Yeah.
And it's not sustainable. And also it feels like torture and punishment. We're not trying to punish ourselves. We're really just trying to support ourselves in the best way we possibly can.
Yeah, that makes so much sense. And I was just thinking about that as you were saying that, how when you start a diet, these new fads, it's like you got to cut all of these things out and then you're going to, instantly lose weight. But then what happens when you're not in those small habits of eating healthy, making better choices? Then, when you do it in small increments, then you're more likely to follow through with it long term.
Totally. And the other thing is, we live in a culture where everything is supposed to be instant, fast, hustle, like all the things.
Right.
But actually, our nervous system kind of likes things slow,
Mhm.
right? We tend towards familiar. This is why habits are hard to change, or you might find that you wind up in the same uh, different relationships with the same personality type, or you keep winding up in like work environments and you're like, what does this keep happening to me? Kind of a
Mhm.
thing. It's because we tend towards the familiar. Familiar we conflate with safety,
Mm.
even if it isn't truly safe, that our system is still on high alert. So, in order to make sure that our nervous system feels like it's safe enough to maybe change, we have to go really, really slowly, like incrementally slowly. And the pace for me is going to look different than the pace for you
Mhm.
based on how resourced you are, how much support you might have around you, how well you're slept, and that can change day to day, hour by hour, right?
Mhm.
So understanding that as well, that like with weight loss or changing our skin regimen, we think we're supposed to swing for the fences and do all these things like all at once and life will change, when in fact it's like, what's the one thing that you can do and do it consistently, right? Consistency
Mhm.
is queen. Like it's those small habits and it's that compound effect. Doing the same thing and slowly adding in, eventually it'll crowd out the stuff that no longer serves you. And all of a sudden you have this like compound effect and the momentum really starts to begin. But I think we underestimate how slow we may need to go and give ourselves the credit and celebrate the very, very small wins, like literally just even contemplating,
Mhm.
I want things to be different. That's huge, right?
Right.
Now, where do you go from there?
Yeah, that's so good. So you have written a couple of books. You're the author of The Skin Whisperer and co-author of Mind Body Therapies and Acne. I am so interested to know. Okay, tell me first about The Skin Whisperer.
Yeah. Yeah. So that came out of my mess, right? So my own journey with trying to recover my own health, that's kind of what it was. And this idea that our skin, our body is always talking to us.
Mhm.
And oftentimes it starts to whisper, a little ache or pain here, a little niggling there, a little anxiety, a little hair loss, your moles are changing. Symptoms are your nervous system's way of communicating. And
Mhm.
it is going to try and get your attention in any way it can. So it starts to whisper, then it starts talking, then it starts shouting. So I wrote that book in the hopes that if I can help people be able to tune into the messages that their skin, their bodies are sending them when they're just a whisper, hopefully they won't get to where I had to get. Right.
Mhm.
So that was the premise for that book. So a lot of lifestyle factors, a little bit of mindset stuff, but that was really before I dove deep into traumatic stress and
Mhm.
somatic. So my approach definitely has changed a lot since then. And then the acne, the mind body therapies, kind of looking at the evidence for acne, and that was a collaboration with a lot of other colleagues to be able to bring complementary treatments forward. Right?
Mhm.
This is not, my approach is not like medicine is bad. It's both and. Right? We may
Mhm.
need these treatments and may need these medications, but if we are not recognizing the role that the mental and emotional piece plays for people, and sometimes is the trigger or
Mhm.
the thing that's keeping that fire smoldering beneath the surface, then people may just start requiring more and more medication without the benefits, but just more and more side effects. So
Mhm.
how can we, incorporate some of these other modalities of both? And so maybe they need less medication, maybe fewer side effects, be able to thrive and change their relationship to their condition,
Mhm.
even if it's not, their skin isn't even completely clear.
Right. Yeah. I mean, that's a difficult thing. And I've always wondered, you know, how come the mental discussion is not really part of that office visit in the dermatology office. And you don't really see that a lot. I mean, a lot of times there's not much time in there. Most of the time patients are coming in and, hey, treat my acne so I can, but we don't really discuss, okay, the cystic acne, how is this affecting your day to day, especially as a young child growing up and dealing with acne and having peers in school, fuss about it, make fun of you, or, whatever issues that you're dealing with in those situations and how it affects you mentally. That's not really discussed a lot of.
No, unfortunately, it's not. And, when I did my training over 20 years ago, psychoderm has been a field for maybe 30, 40 years. We've known about the mind skin connection for a lot longer than that, but we always kind of outsourced that to psychology or psychiatry. It wasn't something that we thought was our responsibility, which is unfortunate. And there was a lot of stigma. I think, for better or for worse, the pandemic was very helpful in elevating the impact and the importance of mental wellness and mental well-being. And unfortunately, because of the healthcare system that we're in the United States, and insurance companies dictate so much of it, I think that there are so many dermatologists who probably would like to engage with their patients, would really like to get to know them and see how things are doing. But in 7 or 15 minutes, you don't have that bandwidth.
Right.
And because of reimbursement, because of restrictions, like you have to keep the lights on. You got to keep seeing all these patients. Right. And so it can be hard. And so there's no space. But just because the current system is not set up in a way that's beneficial doesn't mean that patients aren't deserving of that care. So we're going to have to create it outside. And so that's what I'm trying to do with the Center for Mind Skin Medicine. I'm doing a study actually with an academic center to take a cohort of patients with hidradenitis suppurativa through my 8-week mind skin program, somatic skincare, to hopefully, if we can validate and really legitimize and normalize how important this is for quality of life.
Yeah.
Even if, it's not miraculously necessarily going to clear their condition, can they feel less shame, feel less embarrassment, less anxiety, feel less pain, so that they can live with their disease with more ease, right? Because it's multifactorial. I always think of like skin health is mental health. And actually, it's like mental health plus metabolic health is skin health. Right? We have to look because of that nice network, right? The endocrine system, metabolism, and it's not just our sex hormones. It's your insulin. It's your blood sugar regulation. If you think about PCOS, like this is a prime example. We need to be looking at the whole person. And right now, our system just isn't ideally set up, but it should be. It should be. We need things to change.
Yeah. I started to see that working with the prior authorizations and with the biologics and the specialty medications for like psoriasis and eczema, more so these last maybe 2 years, I'm starting to see questions about quality of life. And, that's something that I'm huge on talking about, is putting in your chart notes and your documentation how it affects the patient's quality of life, because them needing this medication, and we're trying to explain that to insurance companies, which is so frustrating and crazy that we even have to bring that up and say how much the patient really needs this medication, because it affects their day-to-day. It affects them going to work or them going to school, and but we have to put that in there. And now I am starting to see a lot more of that and more awareness around that as well. I mean, just even like on LinkedIn, I've seen, several different campaigns just talking about, how mental health and quality of life and how it really affects patients. And it's great to see there's more awareness around that.
Yeah. And I, the last couple of years at the American Academy of Dermatology meeting, I too saw that a lot of the companies are illuminating the role that mental health plays. And of course, I always go over to all the companies. I don't prescribe any of this stuff at this point, but I'm always like, this is great. Thank you for illuminating it. What are you doing about it? Like, how are you supporting the patients? And it's kind of like crickets, nothing. Right. Yeah. So that's where I'm like, all right, how can I help you do that? Like what resources? And unfortunately, I think there's some people that in the organizations are interested, but is it a fear that maybe it's going to affect their bottom line? Fewer prescriptions if we actually address some of the mental health issues that are driving, actually triggering or exacerbating. And it's not just skin issues. I mean, there's research on all chronic illnesses, cancer included. There are beta adrenergic receptors on cancer cells. So even skin cancer, melanoma, squamous cell, basal cell, there are research about the role that chronic and traumatic stress plays in even skin cancer, tumor formation, progression, response to treatment. Like we need to be talking about this.
Wow.
But my perspective is actually, you might even write more prescriptions, right? Because if patients are starting to feel better, because it's a both and medication and mental and emotional support, and maybe they need less medication, less side effects, they're happier with their drug. Like it's a win-win situation. So we need to move mental wellness to the forefront just as much as we are the tactical and strategic, topical regimens like skincare.
Yeah.
Right. If you think about it, the definition of skincare, what is it? From my perspective, right? It's caring for the person living inside of the skin, like caring for your skin, which is a stress response organ. Like you have to be caring for all aspects that impact that skin. So it's our ultimate boundary between your internal, external environment. Everything you think, feel, and do impacts your skin health. So we have to incorporate that into somebody's skincare regimen.
Yeah. I love that. That is so very well put. I don't think anybody really talks about what exactly is skincare. You think, oh yeah, it's all these different products that I use on a regular basis. That's what it is. Skincare is products.
Exactly. And my philosophy and what I teach in my program and my clients is skincare is relational. Skincare is all about relationships. It's the relationship between the brain, and the nervous system and the skin. It's the connection of the mind body. It's our relationship to ourselves. It's our relationship, right, to all the things that create stress in our lives. What are those things? Relationships with other people, to sleep, to movement, right, to stress. And we have to explore all of those relationships, because if we don't, right, those cues that our nervous system is picking up could all just be danger signals. So if we explore the relationships and see, okay, where are the danger signals? How can I maybe curate, cultivate some more cues of safeness in those relationships? The nervous system settles, comes back into regulation. And anything that soothes the nervous system is going to soothe the skin, right? Because of that nice network, that constant communication between all the systems.
Right. Yes. That is so good. It's just really just kind of redefines the meaning of skincare, but helps people in general just look beneath the skin surface and have a better understanding of that. I love that.
Yeah. And hopefully it can be a source of empowerment, right? Because there are so many things in our world that we cannot control. But how you view your skin, not as like this enemy. Like I had, the most telling example is one of the women who was in one of my groups, chronic skin issue, and always felt like she was fighting, like she was in a battle, like me against my skin, me against like this condition, right? And I have all participants, we do this drawing exercise. She drew this beautiful picture, and the sentence she wrote under is like, I don't have to be at war with myself anymore. And I was like, yeah, right. We talk about like how the body remembers trauma, right? It's stored, and it's more of like, that's the nervous system response, right? Our default mode network, we tend towards familiarity, and it changes our physiology and our psychology. The body can also remember healing. We just have to intentionally, incorporate cues of safeness, change, reframe, right? That the body isn't your enemy. It's your greatest ally. Your skin is in many ways like your greatest asset, right? It can be your greatest cheerleader when things are going well, it's glowing, and that glows comes from the inside out. But it also can be like a gossip. Like it can tell your secrets, right? In a good way, because symptoms are your nervous system's way of communicating. So you might not know exactly what it's saying, but when something shows up, it's an invitation to get really curious from a place of compassion, maybe of kindness, and saying, okay, wow, my skin's really flaring or breaking out. What do I need right now? What do I need most? Maybe it's sleep. Maybe it's a hug. Maybe it's just like taking a walk outside, right? And again, it's that compound effect, small things over time. But I don't think that we oftentimes ask those questions. We just criticize ourselves and have contempt for what we're seeing, rather than being really curious of like, wow, that's interesting. Why is that happening now?
Right.
What's happening in my
Yeah.
life?
Yeah. It kind of goes back to that fight or flight. It's like, okay, something is wrong. I need to hurry up and fix this.
Right. And sometimes, right, if someone, especially with like acne fulminans or like some other condition where it's like acute and painful, and you might need to put out the fire, you might
Mm-hmm.
need a quick, like, go to the dermatologist, like, get the medicine, let's put out the fire so you have the capacity and the bandwidth to breathe. And then, all right, now we can start rooting around and seeing what else, like what really triggered this, what flared
Mm-hmm.
this. But you might need to do something quick, right? It's a both and. This is not an either or
Right.
scenario.
Yeah. It's just awareness. I think that's what keeps coming to mind.
Yeah,
The
yeah.
theme, the common theme here.
Awareness is the first step.
Mm-hmm.
But that's not enough. Awareness isn't enough. Like so
Right.
many of us, myself included, like I do this work because I need this work. Like I am
Mm-hmm.
a tightly wound, like I need, like how did I get into this mess? Because my nervous system was always bracing for impact.
Mm-hmm.
And it still does sometimes. But, when we talk about healing, right, that's a big buzzword. And if you're on social media, like, I'm healed, like my gut is healed, my life is healed. And, you think if you flare again, if your skin breaks out again, if you feel anxious, somehow you failed, there's something wrong with you. And that's not true because no one is really talking about what healing actually means, just like skincare, right? Like healing doesn't mean that your skin is never going to break out again. It doesn't mean that you're not going to feel anxious. To your point, it's that awareness of, I'm really feeling uncomfortable right now. I'm really feeling anxious. What can I offer myself, right? It's recognizing when it happens so that it doesn't spiral you out for days, weeks, months, years.
Mm-hmm.
Initially, maybe it's a couple hours, a couple of days, maybe it's a couple of weeks. And you can bring yourself back again and again with more and more ease, right? You
Yeah.
can recognize it quicker. You have learned how to support yourself through those moments, not to suppress, not to push away, not to quick fix, but you're like, interesting, versus,
Yeah.
just going down the rabbit holes. Like that's healing. It's like, how deep, how, long do the episodes last? And you'll notice they don't impact you as significantly. Some things don't even bother you as much anymore, if at all. But
Right.
that takes time. But it doesn't, we're human. We're going to lose our proverbial stuff and our skin is going to flare. But it's like, how significantly does it impact us? And healing often means that it doesn't impact you in the same way that it did before. You have a different perspective and a different relationship to it.
Yeah. I love that. So, how can people see you, have an appointment with you, or is it actual clinic or is it all virtual?
Yeah, so it's a little bit of both. So I see people online, but in my town, I also do, like, if you ever come to Washington State, I do have a space in a wellness center that I see people in person because that in-person connection is really important. So that's always an option too. I work because I'm a certified coach and practitioner in various modalities. So that's kind of how I function. Even though I'm still licensed in Washington, California, and Oregon, I function more in a coaching and consulting capacity. So I see people kind of all over the world, all over the country. And so they can find me through my website, or some people find me online. I love to speak and share and do workshops. So that's oftentimes how people can find me, and working one-on-one if people need deeper support, doing some group programs. What I'm working on now to make it more accessible is to create a program where people can learn about this, learn about themselves, and be able to stock their toolbox with various somatic tools that they can use.
Yeah.
Yeah.
So, last question that I have for you. What has been the most meaningful part of building Mind Skin Medicine?
I think it's really learning about my own nervous system. Like, you go through this and it's that awareness, like, that expression of you teach best what you need to learn the most.
Mm-hmm.
And as I'm building this, right, I don't have an MBA. Like this entrepreneurial journey can be very dysregulating and very overwhelming. So learning actually how my nervous system is responding and how to better care for myself with compassion, I think, yeah, it's like learning how to walk my walk
Right.
even more.
Yes. That's so good. It's been such a pleasure talking with you and learning so much. I'm so excited to continue to follow you and see what you're doing. I know you're speaking at a conference. Tell me a little, can you share anything with
Yeah,
that?
absolutely. Absolutely. Yeah. So that's the goal, like to just share with as many people as possible and talk. This particular conference is the very first World Congress of Psychodermatology. So that intersection of skin health and mental health. And I am going to be sharing a somatic approach, right? Bringing the body into the equation because still psychodermatology is conventionally practiced for the most part. It's talk therapy and medication management. So I'm really trying to bring this different approach in. So
Mhm.
my talk is going to be about this study that I'm doing with this cohort of hidradenitis suppurativa patients and taking them through my 8-week mind body, the somatic skincare process.
That is so cool. I love that. So we will definitely stay connected so I can hear more about this. Also, if anybody wants to get in contact with you, we'll put your website in the show notes as well. But can you just tell me what your website is?
So my website is my name, actually. It's drkeirabarr.com. And then
Okay.
it's my same handle on social media as Dr. Keira Barr.
Okay, perfect. Well, thank you so much, Dr. Barr. It's been a
Yeah, thank
pleasure
you.
talking with you.
You as well. Thank you.
Thanks for spending a few minutes with me and listening to That's Derm Good. You can expect new episodes of That's Derm Good every week. The podcast is available on your favorite app, including where you're listening right now. Subscribe to the podcast so you never miss a new episode. Bye.